I'm Dr. Colleen Cotton. I'm an associate professor of dermatology and pediatrics at the George Washington University School of Medicine and Health Sciences, and I'm an attending physician and director of our multidisciplinary pediatric HS clinic at the Children's National Hospital in Washington, D.C. So I am a big proponent of referring early and often for HS because for some patients it kind of smolders along for a few years. For some patients it never really gets bad. And for some patients it progresses dramatically within the first few months that they have the condition. So you never really know which bucket someone's going to fall into. And so getting them established with dermatology, which I know where we are and where most people are, that's a long wait list to get into. So trying to do that, as early as you can be helpful. Definitely antibiotics tend to be the mainstay for flares, not because they're treating an infectious cause, but because they have more of an anti-inflammatory effect, similar to how we use it for acne or things like that. And so, while they're waiting to get into dermatology, a 3-month course of doxycycline or clindamycin, that might be very helpful because then we've tried that and then we know by the time they get to me, is this something that's going to help you or not? We also know there's a very, very high comorbidity burden in patients with HS. It appears that it might even be higher than that seen in psoriasis, and we already have clinical guidelines for screening for comorbidities for pediatric psoriasis because that is so high. Um, there have been a couple of proposed guidelines on how to work adult patients up, how to screen them for comorbidities, but in general, the comorbidity burden in pediatrics is similar. So making sure that these patients are being screened for polycystic ovarian syndrome, prediabetes, insulin resistance, obesity, um, depression, anxiety, all of those are more common in patients with HS compared to their peers without HS. And so recognizing those separate from the HS and managing them can be really important. And sometimes helping to manage those comorbidities will improve the treatment of HS. We know that menstrual suppression with continuous oral contraceptive pills, spironolactone, metformin, all of these are considered potential systemic therapies for HS. And if someone has that as a comorbidity, it's much more likely that those treatments will be helpful for their HS. So those are other things that pediatricians can do even before they get to dermatology.